The ribavirin, just so you can see all the other side effects there. Ribavirin, again, the major problem with that is anemia. We expect patients on ribavirin to drop their hemoglobin by 4 or 5 grams. Now again, if you've got other health issues, that's going to have a significant effect on your health. It can actually lead to things like myocardial infarctions, strokes. So there are really, really significant side effects from these drugs. Very interesting, Geraldine there talking earlier on about, be sure you know what you are prescribing, because if the patient experiences side effects from drugs, you're on your own. One of the things that we try, I said before, we try to judge which patients are going to be the ones that will develop significant liver problems and those that won't. And in the past, that's mainly been done by liver biopsy. Now again, liver biopsy puts a lot of patients off. We've moved a lot more towards fibroscanning, which is a non-invasive test. That's the one on the right there, that allows us to determine how badly damaged patients' livers are. But the liver biopsy still holds an awful lot of benefits. And I must say, actually, I use liver biopsies as much to say to patients, you don't need treatment at the immediate time. You can go away and sort out some of the issues in your life because your liver disease is mild. I use it as much for that as to tell patients your liver disease is really quite severe and you need to crack on and get your treatment, otherwise you're at risk of developing cirrhosis. I've said before that the risks of safety comes first. And the risks of the side effects of this treatment are pretty severe. The major one is that ribavirin is going to cause severe anemia. The interferon causes severe neutropenia and thrombocytopenia. In other words, the white cell counts plummet and the platelet counts plummet. And if you've got a patient with cirrhosis and their platelets come down, they're going to bleed. If you've got a neutropenic patient, they're at risk of developing infection. So we have to do regular phlebotomy on these patients. You again will know that venous access in patients who've used drugs for some time can be very, very difficult. And our nurses are very well trained in actually taking blood samples. And often this may well mean jugular venous sampling or even arterial sampling from a femoral stab. And one of the sad things about losing the BBV nurses from the community teams is that we've lost that ability to do complicated phlebotomy. One of the other problems that we have is that patients need a clean environment in which to inject. They're giving injections. Again, not all of patients who are street homeless, it might be difficult for them to find facilities. And peg interferon needs to be stored in a refrigerator. So normally we give the patients a month's supply to keep at home in the fridge. But if they're living in shared accommodation, hostel accommodation, or street homeless, then it can be difficult. We've got to think of new and innovative ways of actually getting their treatment to them. It's not impossible, but we need to think about that. What about the actual costs? Well, some of you might be surprised to see that the drug costs for a 6-month course of treatment are around about £6,500. A year's worth of treatment costs around about £13,000. That's drug costs alone. That's not nurse time, that's not doctor time, that's not overheads and facilities. A rough estimate, if we said that there was 0.1% of the UK population with hep C, we're looking at a drug bill alone of £8 billion. So we need to use that money wisely. Of course, the flip side is the cost of not treating hepatitis C, and you can see here the complications, the cirrhosis, the liver cancer, decompensated liver disease with ascites, the cost of liver transplantation, and the bottom corner there is supposed to be a bleeding esophageal varices, but I think a bit of poetic license there. And what's more, it's all about to become very, very much more complicated. You will all be aware of the new drugs, the protease inhibitors, this holy grail, the new drugs that are going to improve outcomes, are going to shorten treatment durations. But these drugs come with significant side effects. Patients on tolaprovir, 40 to 50% of them have severe skin reactions. Patients don't like to know that they're on treatment. They keep it quiet from a lot of people, but if your skin is dropping off around you, people are going to say, hey, what's going on with you? Something's wrong there. Costs have yet to be decided, but are probably going to be prohibitive in the UK. We've talked NICE as cost-effective, approved peg interferon and ribavirin, The new drugs, there are figures being bandied around £10,000–20,000 per course of treatment for a protease inhibitor. That's on top of pegylated interferon and ribavirin, not instead of. And we're still a long, long way off interferon-free regimes for the majority of our patients. We're going to have to develop 2 or 3 drugs that are going to have to be approved and licensed and paid for before we're about that. Just a quick word about adherence. We know about the importance of adherence in HIV. In hepatitis C, this is the results of a study that show that patients who are 80% adherent with their drugs for 80% of the drug duration treatment, we're looking at cure rates of around about 70%. You drop much below 80% adherence with treatment for hepatitis C, and the response rates are down in the 20s. So if we're going to put somebody through treatment, we've got to make sure that they take the medication and they've got the support. And the way to do that is actually by the clinical nurse specialists. And the ones ringed here are clinical nurse specialists, and those are the ones that manage to keep these patients on treatment. And yes, we probably do need to get those out. People have touched on this before. We talk about a network of care. We've got various, we can't even agree on what we call the person in the middle. To me, he's a patient. To some of you, he's a client or a service user. And what is supposed to be a network is much more of a maze. And what we actually need to do is bring this all together. I'll wrap up there. Thank you very much for your time.